Hi, I'm Dr. Landon Trost, a physician specializing in Peyronie's disease at the Male Fertility and Peyronie's Clinic in Orem, Utah. Now, one of the most common things that we run across in our clinic is patients who report that they initially went to their physician with a complaint of Peyronie's disease, only to be told to wait and come back in a year if it's still a problem. Now, although this was historically correct, we now know that it is inaccurate. In fact, if anything, patients should begin treatment as soon as they first notice symptoms to prevent a worsening of their overall disease. Now, you can see from this particular slide that if you do nothing after the disease first starts, 48% of the time the curve will get worse, while only 12% of the time it will get better on its own. Additionally, among those who got worse, it typically worsened by an average of 22 degrees compared to only 12 degrees of improvement in the group who reported that it got a bit better over time. So, what should you be doing? In general, there are things that you should do, things that you could do, and things that you should not do. So first, things that you should do. There are relatively limited data on which therapies are best in the early or acute phase of disease. Oral pills, for example, do not have any consistent data showing a benefit, and the side effect profile of many oral therapies is not well understood. Because of that, oral therapies are generally not recommended as a therapy of various guidelines. Although they probably don't cause much harm, we just don't know if they do any good at all. Now, in contrast, traction therapy likely has a significant impact early on and should probably be started as soon as possible. Now, please understand that I invented a traction device at Mayo Clinic, so there's always going to be some inherent bias there. But keeping that in mind, a good study by Martina Salamanca and colleagues demonstrated that when used in the early phase of disease, traction resulted in overall decreases of curvature from 33 degrees to 15 degrees at 6 months. When you compare that against the earlier slide that we looked at, you can see that treatment did, in fact, have a very noticeable impact. And importantly, this study did include a control group, which is absolutely necessary for Peyronie's disease studies. Now, based on these findings, the early use of traction therapy is likely key to minimizing the final extent of curvature. All right, moving on to things that you could do. In contrast to traction, other treatments, such as injections with Xiaflex, interferon, or verapamil, may not demonstrate any additional benefits when performed in the early phase. To date, all studies have shown similar outcomes regardless of when these therapies are used. So, typically these injections are considered an option in the early phase, but not necessarily something you absolutely must do. And finally, things you should not do. Really, the only thing that falls into this category is surgery. Since the disease is still changing, surgery should not be performed at this time until the curvature has stopped changing, and ideally all pain has resolved if it were present. The one exception to this is with men who have such poor erectile function that they'll ultimately need a penile implant anyways. And this can be really done at any time. Well, we hope that this video has been helpful. If you would like any other specific videos created on a particular topic, please email us at email@mfp.clinic and we'd be happy to create them. Thank you for your time.